You were smiling a minute ago.
Yeah.
How do you feel?
I feel real good.
Now, the surgery was just yesterday. You got one of the biggest surgery anybody can get in the spine.
Yeah.
And we fused multiple of your discs. You had a scoliosis.
Mm-hmm.
And tell me, how were you before the surgery? How long has it been going on?
Well, I've had back problems for 30 years. I've had 3 different minor surgeries plus a spine stimulator, and nothing helped.
Yeah. And for the last 3 years, pain was really bad.
Really bad, yep.
What were you doing all this time?
Um,
You told me you were crying a
I
lot.
was crying, yeah.
Yeah.
Actually, I actually thought about suicide.
Oh.
And I got too much I got to do, so that's not an option.
Yeah.
I have people dependent on me, so
Yeah.
you can't be thinking that way. But it crosses your mind a lot.
Yeah.
I couldn't function. I had to sit down on the toilet to go pee and wait for it to trickle out.
You're a professional. You're a carpenter. You're a busy man. You're so this is a lot. Go through the life with that.
Yeah.
Now you saw lots of professionals. It wasn't ever that we didn't know what the problem was. We knew what the problem was.
Yeah.
But the problem was just too much. So tell me, without telling names, what have you been told by professionals, by neurosurgeons, spine surgeons?
The first one that I seen, he just wanted me to go to physical therapy. He thought it'd straighten it out, but he didn't really think there was much wrong with me, and he kind of blew me off.
Yeah.
Which discouraged me, right from the start. And about 4 months after I got really bad, I had a dissectomy from another doctor, and it really did absolutely nothing for me.
Yeah, we opened up the space by taking bone away.
Yeah.
It is sometimes that's what we do because that is smaller surgery.
Right.
The alternative or definitive surgery would have been the fusion, what you got yesterday.
Yeah.
So, but that would have been open old-fashioned way just too much.
Right. Yeah.
So.
And that's actually the 3rd time I've had that done.
So 3 microdiscectomies.
Yeah.
And then you got the stimulation device placed.
And then I had a stimulator
But
that did
didn't work
absolutely
either.
nothing for me.
Yeah.
So I had that taken out.
Yeah. And then you saw another surgeon that wanted to do the fusion, but only for 1 level.
Right.
Correct?
Yeah.
Why did he say just 1 level? And you told me that he just changed his mind back and forth.
I had, I don't even know how many steroid shots I had. A lot of them, at least 20. And only one time did it work. So he assumed that was probably the level or a level close to it.
What gives you most of your symptoms.
Yeah, so that's why he decided to do
just one
that
level,
and he wasn't even sure that was the level that needed
Yeah.
fixing.
Now, in reality, your surgery, open old-fashioned way, you have a higher BMI,
Right.
meaning that, there's more tissue to go through to get to the problem.
Yeah.
Can be even 1 level, can be easily 5-hour surgery. Doing 3 or 4 level,
Sure.
that would have been beyond anybody can take.
Yeah,
Your body.
and he told me that we could kill you doing that.
Yeah, yeah. Well, we did your surgery yesterday in 66 minutes.
Yeah.
Our blood loss was, very little, less than a cup
Yeah.
of coffee, less than a cup of a coffee.
Wow.
Whereas after open surgery, people can lose a gallon of blood.
Yeah.
Now, the pain you had in your legs before the surgery, how is it now?
Good.
It's gone?
I can't feel it right now.
Have you already walked?
Yes.
Believe it or not, we are going to do physical therapy, and vast majority of my people go home just next day after the surgery, even after this big surgery.
And that's another reason I was here, because you did some work on a friend of mine. And when I talked to him, I hadn't seen him for a while, but I'd seen him at a graduation party, and he said he went home the same day.
Yeah. Now, your surgery was your surgery was one of the biggest surgery anybody can get. But that's why you stayed over the night.
Right.
But many people, when we do 1 or 2 level surgery, they go home even same day.
Yeah.
Yeah.
And that's when I said, well, you got to take me and see this doctor.
Yeah.
He drove me to your office.
It's a group of us that
Yes.
now we do this surgery. It's not about what I personally do. It's
Right.
about how we do that. And lots of surgeons are joining us, but overall, so far happy with your care.
Yeah, absolutely. Yeah.
Yeah, and the pain. How bad is the pain right now?
I don't feel it unless I move.
Okay,
And it's minimal. It's
yeah,
just those minor surgeries I had.
and
It's no comparison.
And even though we did one of the biggest surgery on anybody's spine can be done. Another thing is, you notice they put you at the end of the hallway here in this hospital.
Yeah,
Do you know why it is?
Because they don't need to do nothing to me.
Yes, because they have to take care of my patient the least. That's why they put my patient either at the end of the hallway, because they have to walk less often there. Because my patient generally need less care than somebody get open old-fashioned surgery, where they put it at the exactly beginning of the hallway. So here's another thing that why you're here. Now, how do you feel?
Good.
Okay.
Spirits are up.
Excellent, excellent. Well, thank you so much. Any other question or comments?
Thank you so much.
Yeah, thank you. Bye-bye.